Hello, welcome to Living and Dying, the show that brings you news and information about Brattleboro Area Hospice. My name is Richard Ewald, and I'm a hospice volunteer. We have a very interesting program for you today on the similarities between beginning of life care and end of life care. And to cover that area, we have a number of people here in the studio today, beginning with Bettina Berg, who is the Hospice Volunteer and Education Coordinator for Brattleboro Area Hospice, Carol Schnabel, who is the Doula Coordinator for Brattleboro Memorial Hospital's Doula program at the Birthing Center, right?
That's right.
And we have Petey Mitchel, a doula, and we have Natalie Merrill, who is also a doula. I think most of us know what a hospice volunteer does, but Bettina, perhaps you could sort of encapsulate that service for us.
Sure. The volunteers at Brattleboro Area Hospice support people at end of life. We are a non-medical, all-volunteer hospice, and so our volunteers are trained really to offer what we call practical and emotional support. We go into people's homes, we go into nursing facilities, wherever we're needed, and offer that support to clients. We call them clients generally, and their families as needed. And we also have a bereavement program where we train people to support folks when there's been a death loss and support them in that way. So that's very nutshell for what we do. And
Carol, what is a doula?
Well, a doula, that word comes from the Greek, and it originally meant a servant or to a woman, and it's been used in recent years to define women who help support women in labor. And it's not a doctor, not a nurse, not a midwife. We are also not medically trained or licensed, and we're there to give emotional and some physical support in that we can offer comfort measures. We can wash somebody's forehead with a washcloth, or bring them ice chips, or suggest different positions they might try to be more comfortable, or so we do some hands-on things, but we also just provide company. And so we sit with someone for the duration of from the time they want us till after the baby is born. And since our program is the Brattleboro Memorial Hospital Volunteer Doula Program, we're all volunteers. We're there for anybody who would like a doula who's having a baby there, but also nurses and doctors, midwives are on shifts, and we're not. So it's nice to have that continuity of care, because the labor can go far more than a shift. So
Well, it sounds like a very traditional sort of work. How long has the Birthing Center had this as a formal program?
It started just 9 years ago, Labor Day, and we launched. We were trained. I was part of that first training, and we trained in the summer and then launched it on Labor Day, obviously for that reason, so we've been going slowly about our jobs all these years, and then I took over as coordinator a year ago, and we've been trying to be more visible in the community and encourage more women to use our services, and also encourage more people to sign up to be doulas, because we could use more.
Well, I understand, Bettina and Carol, that you have sort of, between yourselves, talked about the similarities in the work for quite a while. And earlier this summer, actually had a program where hospice volunteers and doulas came together and discussed what some of those similarities are. I think you attended that program, didn't you, Petey?
I did.
What went on there?
Oh boy, there were doulas and hospice workers there, and also nurses that were involved with both aspects, I believe, from from BMH and also from Keene. But it was interesting because it felt like we just skimmed the surface, because there's just so many similarities and so much depth to be able to share with other people that have been not certainly isolated at all on what they're doing, but coming together and sharing those similarities was really just pivotal for me. I'm looking forward to the next time that we're able to do that.
And it sounded like when we were talking earlier, you talked about how it also provided the setting to talk about some things that really matter in your life, and listen to others who talk about on a similar level. That sounds like it was pretty enriching experience.
It was. It was a unique space to talk about unique work that affects all of us. at some level, birthing and dying is something that none of us can escape, and there are, I think, just a small minority of the population that decide that they want to get involved in volunteer work in either aspects of that, and so our gathering really provided a chance to go deeper into those topics and to highlight some of the really special things about what we do.
Carol, you've said that, and Bettina, you referred to it as well when you were talking about how hospice volunteers are not medically trained, and doulas do not provide a medical service either. What does that mean that you are paying attention to during that period?
Well,
certainly when people require intense medical
it's we're paying attention is what we're doing. That's a good word to use, and it's so varied. It's very hard to give a job description sometimes. We do get, as part of our doula training, we get trained in what goes on in birth so that we can be very familiar with it, so that we understand a lot of it, but we don't have a license to practice. But we pay attention to the emotional and physical needs of the woman in labor, and we also pay attention to the other people in the room, and oftentimes that's a partner. Sometimes it's the mother of the laboring woman. Sometimes it's quite a few people. And we try to sometimes help that dynamic. I often feel like as a doula, if a woman is there with her partner, I really want to see the birth not just of a child but of a family. And so it's a scary experience, even if everything's going well, because it's unknown. It's a journey that's unknown. So I try to make sure that the partner, when he's watching his loved one go through something difficult, can understand it better. And I also try to get him or her involved if I can, because that often makes for a better, outcome for all of them. So, we think about all the levels, but we also do practical nuts and bolts, like, saying, why don't you move this way? Why don't you stand up? Why don't you sit down? Why don't you try a birthing ball? Just to different things that might make the woman feel better physically.
Yeah, if I were the husband, I would be in that situation you described. Seeing my wife in agony, but also feeling like I wanted to run screaming from the room.
Right.
So it sounds like a delicate thing to negotiate there.
And I think the hospice workers also work with the group that they're with. It's not just a woman or a man dying in isolation, right?
Right, and one of the pieces that I assume is stressed in both trainings is a lot about listening. It's about listening to what's being said, what's not being said, what's being communicated in ways other than just verbal, and that same support that you're speaking of, I think hospice volunteers do try to offer to other people who might be present. Just the comfort of having someone who's maybe been through a situation before, who can just sort of model what's okay. And obviously there are doulas who have given birth. There are no hospice volunteers we have not died. We don't have that experience, and yet a lot of us have done the work through the training of thinking about what that might be like for us, what that means for us. And that's a big piece of it too, of the training, really thinking about what our thoughts and our feelings and our fears may be, and being okay with those, so that we can hopefully be a better presence for other people.
It strikes me that both roles require that sort of pause outside the door, where we sort of leave all of our own stuff out there and just step inside to just be there, as you've said. But that aside, Petey, could you describe some experiences you've had as a doula? What do you actually do? I mean, I know there's some doing involved in this.
One of the things that I like to do is to get to know the person first, the mother first, the family first, and have a few visits ahead of time before we get into the process of birth. On the other side, with someone having to do with visual work, or having to do with, there's visual work, there's patient care, there's bereavement. being involved with those facets with hospice is quite different, but yet similar. With preparing yourself, like you're saying, staying at the door for a second and checking out, and just trying not to bring your own material in unless it's hopefully to be there just for that person or family, and being very helpful, and being sensitive to how close to get, what their needs might be, with people that are dying, whether they want closeness and talking to, being aware of what that situation is, and also with someone, a woman that's giving birth, do they want pressure? Do they want just presence? Or they do, just being sensitive to that whole piece. It's so similar that way with whether someone is dying or giving birth, just being sensitive and attuned to what that human might need and the family around.
There's that quote that says something about, don't just do something, sit there. And sometimes that's what we need to do, is do less and just be more.
And that was kind of the genesis of how our workshop started. Was I had been a doula for over a year and a half, when my mother, who was elderly and had been infirm for a long time, but she took the next step and really started to die, and we had someone from hospice come and help us just train, because she had people taking care of her. So we didn't need hospice workers, but we needed some training in what we were doing. And after we went through that, and then my mother did die several months later, I felt like I had done a lot of what I do with women in labor, and it obviously is on a different time scale for dying, and even a long labor is often shorter than anything but a really quick death. And so I think that being present part, that there's a lot of times when you come in when somebody's dying, and there's really nothing you can do except be there, and there's really nothing you can do a lot of times in labor. There's plenty, when you were asking what do you really do, that we do hands-on things. We do take them for walks. We do bring them ice chips. But there's a lot of times where we are just present, and leaving your own agenda at the door is a big part of it, like you mentioned. But it's that feeling of just accompanying them. And I know I had a really fast labor for the birth of my second child, and my husband was afraid that nobody was going to make it, because it was in our living room. We wouldn't have made it to the hospital probably, and he was afraid that nobody was going to make it who was trained. So he called every friend nearby, and we had what felt like a lot of people in the room to me, which isn't the way I would have ever planned it. And they didn't do anything. A fast birth is it's just a train leaving the station, and there's really nothing that anybody needs to do. And they didn't do a thing. And afterwards, I felt this incredible support from that group of friends that had been circled around me at a they just were quietly bearing witness, and that's I think one of our commonalities.
Natalie, I know that you've also been through the hospice training, hospice volunteer training, and you're also a nurse.
Working on becoming a nurse.
Working on becoming a nurse. Well, let's just say that you have the perspective of both a nurse and the perspective of a hospice volunteer.
Right.
Where do you see the shading of the difference and the similarities?
Well, they're very different hats, because, I haven't experienced hospice volunteering quite yet, but in terms of my birth work, I have been a doula while being in nursing school and thinking about nursing and labor and delivery and that type of support. And you have to be very clear going in which role your focus is. I think specifically because of what we've talked about with in our work as hospice and doula volunteers, we do a lot of being and not doing. And nurses and other medical personnel are very busy with what they're trying to keep track of and monitor, whereas when we go in as support, it's a lot of, I would say, just quiet assessment, and then reaching out in sort of strategic ways to find out how the person is doing, what they might need, or sometimes intuiting what they might need, and just offering that without having to ask them questions, because I think in both circumstances, the poking and the prodding is what the medical personnel does, and we kind of take a softer approach in providing what folks may need.
So the time frame of hospice volunteering and doula work can be very vastly different sort of schedules. It sounds like, Petey, you were saying that you like to visit beforehand to understand the family a little bit more than the house, or actually know it because it's at the hospital. Whereas a hospice volunteer might be there for weeks.
Might be.
Or longer. So when does the birthing center arrange to have more than one doula per birth, just in case it goes on too long for the first volunteer?
Well, that's what we try not to. Occasionally that does happen, because we're, first of all volunteers, and we do have lives. But the goal is that once you get there, you try to clear your schedule. And so that the hospice people, as far as I understand, they go more predictably. They say, I'm coming at 10 o'clock today, right, or something. Yeah. But we, once we get the call, we stay unless we can't. And if we can't, we'll try to get someone to come in, obviously. But so we've been known to be there 36 hours or something, and sometimes we're there 3 hours. You never can predict. And we work in 2 different ways. Or 3 different ways. We sometimes know the family ahead of time, have a pre-assigned client, and meet them ahead, and then they call us when they're in labor. And then other times we're just on call. We try to have a doula on call every day, so there is coverage. That's one of the reasons we need more doulas. And then the third way is sometimes there's nobody on call, but we need somebody, and so the nurses will start calling a doula to see if someone can come in. But if we come, we usually come with the idea that we're going to be there for a while.
Pack a lunch.
And
a pillow.
I know that as a hospice volunteer, sometimes the volunteers looked upon as something of an expert, or someone who knows a little bit more about death or dying, and that could be any number of issues related to the legal ramifications, or et cetera, et cetera. And volunteers have varying degrees of expertise about that and can answer those in a different way. Are you also, as doulas, look to for information about what's happening to me or what's happening to my spouse during this? And
Yeah.
I think primarily with the partners, I find that a lot of what I do is just reassurance to the partner that yes, this is normal, this is the process, this is what happens. Usually the woman who's laboring is very internal and just kind of, very focused on the work that she's doing. But often it's the partner or the other family members that kind of have that panicked look in their eyes that you just want to, provide reassurance to them. And then encouragement to the mother when she does hit those roadblocks where it's a total unknown place that she's never experienced. So in that sense, we are, we can be guides. I wouldn't say that we're experts.
Well, we legally we can't give any kind of medical advice. We can tell them if they ask a question. We can be a conduit of information back and forth. Sometimes they have an easier time asking us, and we can check with a doctor or a nurse or a midwife. And also, sometimes we can say when they ask about something, well, in the past I have seen this, or we can explain things. We can't give any real, if there's anything really medical, that would be practicing without a license, and that's frowned upon.
And that's true within the hospice realm too, because we don't always know what's happening for someone, and so to offer something, as though we know the answer would not be appropriate. And something Natalie was talking to, just the word labor and the person. One of the things that I talked about with my partner at the doula hospice meeting was the fact that the woman in labor and the person dying are both in fact working. We don't know on the outside what that necessarily means or how that plays out. And that same sense of reassuring family that when someone is perhaps turning more inward and not communicating as much and seeming to sleep more, that's not a personal or lack of interest. It's just that people seem to need to gather their spirits to do the work of dying, and we think of it even sometimes in deaths that appear smooth or easy or good, as people have come to call it. We don't know, and but it does seem as though there's very personal work going on, and as volunteers we can similarly reassure family that what you're seeing is normal, and help people find other ways to be supportive of that person and of each other.
And I think one of the things we also talked about was the process of making choices in both aspects, and how we can support folks and encourage them in making choices and helping them to know the options that are available, but again, not giving answers or telling them what they should do, but just providing them with that informational support so that they can feel as if they have what they need to go forward.
They have autonomy.
Right.
And sometimes that means helping them ask the questions too. You know, sometimes if they might not even realize they have a choice, so we might just,
Yeah, it's kind of like having a birth plan before you're going into your birth. If you're, in other words, you've made your choices as to how you would like your birth to go, and then there's something called a directive where you might want to share with your team what your needs and wishes are for your dying process too.
Could you explain more about a birth plan?
That would be a good thing for Carol to do.
This sounds a little more technical.
Well, I'm not really Miss Technical, but it's something that women sometimes do nowadays with their providers and their partners or whatever. They come up with an idea of what they might like to plan for or not plan for. And it can be as simple as saying, I'd love to have, some Mozart piped in on my CD player. To, I really want to walk as long as I can. I don't want this, I do want that. And I always try to tell people that it's great to tell us what you do and don't want, with the understanding that that we never know, and it's one of those things you really can't plan for. It's good to be prepared. It's good to educate yourself into what may or may not happen, but it's the best laid plans. So a birth plan can be simple, it can be complex, it can be followed to the letter, and it can be thrown out the window. But it's a way of preparing, and I do think a lot like advanced directives. I think it's a roadmap, and sometimes it gets followed and sometimes it doesn't. But I think probably both of those things, from people like to think about their death and think what they'd like, how they'd like to feel about that, and to know that there's a certain amount you can choose. And it is a really good thing for women to have the birth plan, because then their providers know and try to honor as much as they can, and then when something comes up and they say, I know you didn't want this, but they explain it better than if that's one of the good things. And probably that you can probably speak to the end of life, how that works. If someone has an advanced directive and says, I do and I don't want this, and somebody might say, but does that come up? Or
we're not, because so much of that's medical. We're often not involved. We do in services and talk about advanced directives, what they are, what they can and can't do. And I think for both realms, so much of it is communication and just letting the people, which is why sometimes the volunteers on either end are so helpful. We're sometimes, just because we're not family, we're just folks who are there, that sometimes it's easier to talk to us. So sometimes we do end up knowing things that can be helpful to pass on to family or medical professionals. But that said, I think in the work I've heard about advanced directives, definitely we should all have those. They're things that we should think about, and sometimes things happen and things can't go the way we necessarily have planned even with all our planning. So.
Mm-hmm. So at a hospice setting, either in the home or a hospital or a nursing home, there are likely to be a lot of I think, and there may be more family members there than there would be at a birth.
Sometimes, although we have a lot of people who go into the hospice volunteering because they feel so strongly that people, shouldn't die alone,
Right.
and it's surprising how many people don't have family.
Mm-hmm.
They're also, it's just one of those you just can't quite carve it out.
Mm-hmm.
But sometimes there are a lot of family.
And that's very much my feeling about giving birth, is no one should give birth alone. And it's obviously, if you're giving birth at Brattleboro Hospital, there's a staff there, but there's plenty of women who don't have any family member or friend with them. And you also brought up the point of, we're not family, and we're not, that's the other part. I think that one of our commonalities that we talked about was we fit into a hole that nobody else does, because we're not professionals, and so they're a little bit more relaxed with us, and yet we don't carry the baggage that mom and dad and sister and brother and husband or whatever. So often we're in this very special place that makes it easy to communicate with us and us with them, easier than with anybody else. Yeah.
Is that clear from the way the doulas appear there? For example, there you are in the hospital, Petey, and they're doctors and nurses. What are you wearing? Are you wearing something that differentiates you from them so that it's more
your
obvious?
Hospital clearance badge, your badge really, other than that. And we're not wearing a uniform.
You're not wearing your T-shirt that says...
No, I think I want to do that someday.
Yeah, we just got those T-shirts for the parade this summer, so I have worn mine since we've had that, but we never had them before.
It says we help babies out.
Yeah, but we actually that's on the banner. It's on the banner and on the.
It just has a name and then little feet on the back.
Yeah, it's not
really
on
cute.
the T-shirt, but it has our name. But we don't have a uniform, and we intentionally are not allowed to look like the nurses because they don't want to confuse us with medical people.
Right.
But we do have a badge so that they know we are legit, and so
Right.
so we just look like
Regular people.
regular folks, as you said. We hope.
Well, at the beginning, we started talking about the beginning of life and end of life, and I think I'd like to spend a little time just thinking about that aspect of it, that it's basically a sacred transition at either end. And can you speak to that? And what is that like?
Well, I was just thinking about the question that was posed earlier about what happens before you walk in the door, as the volunteer. And I think, we all take a deep breath and head in, but we know that we're heading into this time out of time, just this spaciousness, this sacred space that just doesn't exist anywhere else. And you lose track of time, you lose track of everything else that's happening in your life. You just are there and focused and present. And I would imagine it feels very similar to be with a person in their last moments of life. So it's very hard to describe. I don't know if others have.
Well, I guess I'd like to just put in before we close that it's an honor to be at the birth of a baby. It's just such a privilege, and people usually thank us and they say the kindest words, but I think probably I'm speaking for all of us volunteers on both ends, but we probably feel like we get more than we give. It's really, it's just we might be there for a long time with no sleep and really maybe deserve some thanks, but it's really a privilege. It's a privilege. And it never gets old.
Being allowed to be part of such an intimate piece of someone's life is just really amazing, whether it's the dying process or the birthing process. Yeah, it's a real gift to be able to be there.
Yeah, nicely said. I would echo what you both said.
Well, thank you for your presence here today. This is inspiring. We're bookends.
Good way to put it.
Bookends for everything that comes in the middle. Thank you for joining us today. Brattleboro Area Hospice, 257-0775 or brattleborohospice.org. Brattleboro Memorial Hospital's Birthing Center,
257-8226.
Very good. On the spot.
Yeah.
Thanks very much for joining us, and we'll talk to you next time.